So a lot of times when patients come to see me during their consultation, they tell me they have concerns with their implants that it's ruptured or leaking because their breast feels different than it did immediately after their augmentation, right? It's a little looser where they start seeing ripples in that implant a lot more. And their concern is that the implant's deflating or something's kind of coming out of the implant itself. So certainly if it's a saline implant, that can absolutely happen, right? So you get some fluid loss, the saline drains out of that implant a little bit if there's a rupture leak in it. Now you see a lot of ripples in that implant. It's very obvious that this breast looks very, very different. Silicone doesn't do that to the same extent because when that ruptures, it's contained within this capsule to some extent. So it doesn't look or feel a whole lot different for most patients. So why does the breast change around it? Well, over time, what's happening is the breast is softening. The breast is really fibrous when you're very young, right? You get this dense breast tissue. That's what they call on mammograms all the time, right? Dense breast tissue, dense breast tissue. So it's really thick and fibrous breast tissue. As we age, it becomes softer. So you become softer breast tissue, becomes a little more fatty breast tissue. So now it responds to weight changes, weight losses a little bit more. Now the pressure of that implant can cause some changes to the overlying skin and overlying breast tissue itself. So when you change positions, when you bend over, turn to the side, you can start seeing some rippling in that implant that you weren't seeing before. And so a lot of patients have concerns. Well, that may be because the silicone's completely draining out of there. Most of the time, that's not the case. Most of the time, that implant's pretty static. It's the breast that's changed around it over the course of years. So I tell patients, certainly with a saline implant, that can very obviously make some big changes for you. Silicone can to some extent as well, right? So you wouldn't rule out a rupture in the implant. But a lot of these changes over time when the breast looks different than it looked 5-10 years ago can be the overlying breast changing as opposed to the actual implant changing itself.